Mumps outbreak. Mumps is a viral disease that is and has been spreading all over the world. Mumps illness comes from a virus and it affects the parotid glands on each side of the face. Mumps is spread through contact with respiratory secretions, including saliva from an infected person. In addition to that, the virus can be spread through droplets of moisture from an infected person's respiratory tract, which is the passage where air passes through while breathing, for example, lungs, throat, mouth, and nose. People who have had mumps are usually protected for life against another mumps infection, but second occurrences have happened in the past. The National Center for Infectious Diseases, NCID, said that mumps reportings have been inconsistent. The parotid glands are the largest of the salivary glands and are located in your mouth in the upper part of the cheeks right in front of your ears. The other two salivary glands are the sublingual and the submandibular gland. The sublingual gland is located below the sides of your tongue right under the mouth, and the submandibular gland is located below your jaw. All the glands have a tube leading from the gland to the mouth. Symptoms. When a person is affected with mumps, it causes their parotid glands to swell and may be tender or painful. Symptoms show up about 2 to 3 weeks after someone is exposed to the mumps virus. The first occurring symptoms are flu-like symptoms such as fever, headache, muscle aches, or pain, not wanting to eat, and tiredness. In some cases, more severe symptoms appear, such as meningitis and inflammation of the testicles or ovaries. As the disease takes course, other symptoms include swelling on one or both glands on the sides of the face, pain around the swelling, as well as swelling of glands below the floor of the mouth. Prevention and treatment. You can prevent mumps virus by getting the vaccine, which is why it isn't popular in the U.S. Mumps spread very easily about 5 days after the swelling starts. The illness is typically self-limiting, but if you think you have mumps, you should first contact your healthcare provider and let them know beforehand. If you're unable to do that right away, it's suggested that you take supportive care measures, including resting as much as possible, use of pain relievers, and use of cold or warm cloth over swollen salivary glands. During an outbreak, to limit transmission, countries where mumps vaccination is widely available, public health authorities may advise an additional dose of the combination of measles, mumps, and rubella, MMR, for people who have higher risk of contracting mumps. Those groups who have close contact, such as sharing equipment or drinks with a person who has mumps, are at higher risk of contracting the disease. The disease is rare in the U.S. due to vaccinations, as there are less than 20,000 cases in a year. But in other countries, including South Africa, the disease is a little bit more prominent. Mumps generally infects children aged between 5 and 9 years old, but it hits younger children as well as older children and adults. Data is recorded by the NCID for positive cases of mumps from 2013 to now. The yearly positivity rate had previously peaked at 39% in 2019, but now the rate is at 69%. This increased rate of mumps makes it an outbreak. Children 1 to 4 years old had the highest positivity rate at 84%, followed by children 5 to 9 with a percent positivity rate at 83%, then 30 to 34-year-olds with 67%, and 10 to 14 following right behind them at 54%. In the same data, the epidemic curve shows a steady increase in positive steps starting in week 6 of 2023, with the most cases coming from KwaZulu-Natal, Mpumalanga, and Gauteng. Since vaccines aren't universally available in South Africa, the Institute recommends getting advice from local healthcare provided if infected. There are 2 types of tests used by the NCID to confirm mumps as an outbreak. These 2 types of tests are mumps IgM, which is an antibody test that detects the presence of IgM antibodies in the blood and indicate recent infection with the mumps virus. And the other type of tests are PCR tests, which are molecular tests that detects presence of mumps virus RNA in a sample and can confirm active infection. In 2023, 1,322 mumps IgM positives and 30 mumps PCR positives were found after collecting data from 20,813 different tests. The percent positivity rate is identified at 69%, which is significantly increased from years past. All right, my first question is, can you give me a general view on mumps? Tell me what it is, where it comes from, and how people are able to contract it.
Okay. Well, it is a viral illness, usually of childhood, so very common in children less than 10 years of age and sort of preschool going, so about 5 years, 6 years of age. So it's a viral illness caused by the mumps virus, and I don't know a lot of details around, when it was first discovered and that sort of stuff, but I think that could easily be found on the internet. But it's one of those really important viruses that forms part of the immunization schedule in many countries. And the idea is that it is controlled and, that it is minimized in terms of how many people can contract it. For the most part, it causes very mild disease in children. And, it's kind of very mild. The bigger complications and the concerns around mumps are the complications that can occur with it. So the complications include things like mumps orchitis in boys. So it causes inflammation of the testes. And the big concern with that is that it can cause infertility. And in addition to that, I think deafness is one of the other big things. It's not really one of those viruses that's on a lot of people's radar because, of the relatively mild disease profile. And in terms of how it's contracted, so what it actually does, it affects mainly the salivary glands, the parotid glands, and the other glands around the neck and the mouth. And so you'll see a lot of the kids who contract it have almost like this bulldog faces because of the enlargement of the parotid glands, and it can cause it's pretty much mild illness. I'm trying to think what the symptoms are. So there'd be reduced appetite. And I think there might be some respiratory symptoms, just to confirm that. But how it is spread, obviously, is with contact. So if you're in contact with somebody, there's infected saliva and that sort of thing. That's how it can get spread. So relatively easily spread amongst children, if you can imagine children going to preschool and that kind of thing. And yeah, it's quite surprising that there would be an outbreak, and I think it's quite important to think about the reasons why there's been a sudden outbreak, particularly in South Africa, where for the most part there haven't been a lot of issues. But I hope that answers your question. I don't know if I missed anything.
No, that's perfect. Thank you. My next question is, what are the possible reasons for South Africa to currently experience an outbreak after it being basically after 2019 mumps haven't really been relevant. So I was wondering the reason for it being an outbreak currently.
So it's a really good question. The areas where it has been detected is in just, I think, about 3 provinces where it has kind of been picked up. And I wonder if, this is me just postulating, but I wonder if, with COVID and a lot of people probably not seeking out medical health care, we've been quite cautious about going to hospitals and clinics because of, the risk of contracting COVID, could have been responsible for the spike in mumps. Other thing is that, and this is important to know for the South African context, is that there are 2 immunization schedules. So there's one immunization schedule for the private sector and another one for the public sector. The immunization schedule in the public sector doesn't actually include a vaccine for measles. So it's usually just, sorry, did I say measles? Mumps. It just includes, it's just the mumps that is vaccinated for. And in the private sector, they have measles, mumps, and rubella, the MMR vaccine that is given quite routinely. So I wonder if, with a lot of people not seeking out or going to healthcare facilities during COVID, unless they were, critically ill, as a protective measure, could have been a cause for the spike, and then the lack of vaccinations, particularly in the public sector, contributing to that. So those are kind of my thoughts and hypotheses on it. But then also it's in very particular regions. So it's in like 3 different provinces of South Africa. So it makes you just think about maybe the healthcare systems in those particular places, that maybe, there might be something about that as well.
Mm-hmm. Okay, thank you. So next is, what are the tests used to determine mumps, and what do they mean?
So you can read a little bit more about this on the internet just to get a better idea. But the important one would be like a swab. You can do like a swab of the mouth, and you would be testing. I don't know. You must be familiar, I'm sure, with PCR testing with COVID now. So PCR testing are done on those kind of samples. So whether it's a salivary sample. Yeah, so PCR testing, I think, is pretty much the gold standard. So that would be looking for DNA of the virus itself. So whether you do a saliva sample, whether you do a blood sample, you'd be looking to see if, saliva sample in particular, if you'd be looking to see if the virus is present. And then you can look for antibodies in the blood, for example, IgG or IgM. I think IgM is probably the one that's more relevant.
What does IgM stand for? Do you know?
So it's just, it's immunoglobulin. Ig is immunoglobulin, and there are different types of immunoglobulins. GAM, but, an E, I think. But the important ones relevant for detecting active infection would be the IgM, immunoglobulin M.
All right, sounds good. Thank you. Okay, my next question is, are there any other African countries experiencing an outbreak?
Yeah, I think some countries that may not be as prominent at reporting, the outbreak. They may not be as vigilant in terms of surveillance, and I'm not too sure, what other countries have in terms of their surveillance. But I certainly have heard of countries having cases of mumps. I'm in Rwanda at the moment, and there've been a couple of reported cases here. Certainly in next door, I think in Uganda, maybe even in Burundi. There may be some others that I'm not aware of, but I think certainly there are the countries that are having that kind of, they're having cases. Whether or not they're ready to call it an outbreak or not yet is, dependent on their definitions and, their surveillance. But I definitely think that there are other countries, including the States, if I'm not mistaken. They might have reported some cases of mumps. And I think with with the amount of travel that people do nowadays, post-COVID, that it certainly can't just be localized to one region.
Yeah, okay, that makes sense. Another question I had was, is South Africa taking any more measures to prevent the disease?
So just read the articles that I sent you to see if there's anything there. I certainly think that they definitely will be taking measures. I think the first step is obviously being able to detect it, and I think that they've been able to do that quite well, and they've been able to quantify it quite well in terms of region, in terms of age groups. They stratified it to see, who are the people that are affected. And I think then the next step then is to intervene. And, the big thing obviously would be, I think, to push, vaccinations is probably one of the big things that they need to do. And then obviously then to treat those who do have it and try and limit the amount of spread. So I'm sure those are things that they're doing on the ground. I'm not there at the moment, so I don't have my ear to the ground, but I suspect that that's probably what they're doing.
Got it. All right. Thank you. And this is my last question. Let's say I read both the articles you sent me and I did some other research about mumps. What is something I wouldn't know about the disease and the outbreak, or the outbreak?
That's a good question. I don't know that there's anything that you wouldn't necessarily know. I don't think that there's anything too, I think just given that it's quite a well-known and well-described virus and disease, and, the protocols around how it's treated, how people get vaccinations, is pretty straightforward. I don't know that there'd be anything that you wouldn't not know. I think some things might just be context specific. So there might be certain contexts, the context of South Africa, for example, that you might not be familiar, that may have certain nuances around, maybe difficulties around getting vaccinations to remote areas, for example, given that there's an important cold chain to be carried with vaccinations to make sure that they're still working and functioning properly. Those are things that, sort of public health stuff to think about. So those kind of things might be, you might not be aware of, but you may not necessarily need to know, but you can, I'm sure, I'm sure it might not be specific. Well, actually, I don't know. Maybe because you're looking at South Africa specifically, those are the kind of things that you might need to know a little bit more about, the context of South Africa and how things work in the government sector versus the private sector, limited resources, that kind of thing that might not always show up. But that's important to know, I think, to understand that, it is a third world country, that healthcare, access to resources, both, staff as well as access to, whether it's medicines and that kind of thing, is not always as widely available. But what a really good thing about the South African context is that public care is free, certainly for all South Africans. And vaccinations would be given in primary healthcare settings. So the way the healthcare system is divided is into different tiers. So there's primary healthcare, which is like, clinic cases. If clinics can't handle certain illness, then they refer up to secondary level hospitals, which is like, districts, and they will have more facilities. And if they can't handle things, they would then refer to like a tertiary hospital, which is like a referral center with, all the access to, the big stuff, the scans, the specialists, that kind of thing. So this kind of problem can easily be handled, at primary care level. So I think that makes it quite nice and easily accessible for most people, all people. And those who live in more remote areas can hopefully be accessed relatively easily. So yeah, that context is important. And I'm trying to think what else. I think because for the longest time it hasn't really been an issue. Mumps is not something that pops up on people's radar as a big alert. A lot of people might not know a lot about it, but I think now that there is an outbreak, a lot more people will be learning about it, and hopefully be a little bit more aware. So hopefully it can easily be put, it can be controlled, or it can be, handled quite easily. And there aren't really devastating effects, like I mentioned, of having mumps.
All right, thank you for the interview.
Yeah.